Good afternoon, everybody. Back again. As I had promised, we are going to be using the Embrace Active Scar Defense, and apparently I've done some research today. I noticed that there was some bad reviews, but I also noticed there was a guy by the name of Ben Hansen who says it actually works. He used the normal scar plasters, but he also tried this one, and he says it is a little more expensive than the other one, but the results are faster. And after 2 months, he's absolutely amazed by it. So I'm excited to try it. Remember, I am 4 weeks post-op. So I've never used this before. So I am nervous. So what we need our Embrace, and this is what it looks like. I have opened one. We need alcohol wipes. As you can see, I bought them like this. But before I actually had a shower, and I of course used the betadine solution. I don't want any bacteria or any of that to go onto the scar. So what I'm going to do is I'm going to show you the scar one last time. You'll notice I also have an old scar here, which is actually an old cesarean scar. So I'm going to try and see if that helps. Remember, this cesarean scar is over 5 years. Remember, there's puckering. So apparently it's designed to release the tension. So obviously this is tension within the skin. So this is a definite after 10 days, we'll have a look at this. It also says it's proven, it's clinically proven to effectively reduce the appearance of the scar. So you can see my scar is quite intense. Remember, I showed you in my earlier video. I also have a little scar, and this scar here is where they actually stitched the pipe down, the drain pipe, you know, the one that was out of my body, and this was where the pipe was. So I'm going to see if it's long enough. So we're going to start this side. The doctor did say I should pull it a little bit, but we'll see how that works. All right. So apparently that's the strip. You have to open it, put it out this way. We have to be careful not to touch the any of the adhesive there. Apparently we need to just roll it out like this. They say it's quite easy. We have to apply the line on the scar. So I just want to see where I'm at here. So I'm going to do that and rub it on the actual scar there. They say to hold it down and then of course rub along the lines that are on the therapy treatment. So we're just going to do that. Can you give it quite a solid rub all along these lines here? This is to make sure that it sticks. Oh, gracious, I didn't use the alcohol wipes, but that's okay. We'll see if it holds, but I did wipe before I did start, so that's fine. But we'll wipe the other side to make sure that it's perfect. So we are on. Again, we just want to make sure that it's completely on properly. I want to make sure of that because I don't want to have any issues with it as I pull out. Then it says you have to yank these out. So let's do that. Again, before I pull it, one last time to make sure that we have it properly on. And then we lift it off. And they say that you can have some puckering or bubbling. And what's nice is it's nice and clear. So that's how you're going to apply the Embrace. Now, I'll show you this side. And we will do another review again. I will put the other one. Apparently, you just put it on the top. So I have another one here. We will open this one. And apparently the same thing. Remember what I said? We have to open that way. Turn it back. We don't want to touch the sticky bit. We just want to get this released here. Okay, we've done that. And now I want to see, you see now I won't be able to get it over there. So what we're going to do is we're going to start kind of, where's my scar? I don't even know where my scar is. Okay, there. Let's get it right there. So we're basically going over. This looks like it's going to be shorter than my scar. So what I'm actually going to do is I'm going to leave that one there, but I'm going to start as close to the edge of this one as possible. There. All right, looks like we got it. So we're going to do the same thing, rubbing across the lines. Like I said, I did do the alcohol wipe before I placed it, so we're just going to go on there. We do have a slight hole in the middle here, but I think it's fine. We'll see how it works. We'll check it. Remember, I'm going to go through it a couple of times to make sure that I've really got it stuck down well. I think we're good there. So let's remove that strip. And let's go back again one last time down each of the strips to make sure everything is properly sealed. And then we lift it off. We pull it down. I'm sorry about that. We pull it down. Now I do have a little hole right here, which is not good. So what I'm going to do is I have to order, of course, I'm going to end up having to put a third one, but I'm going to leave this for 30 days. If you have a really close look, it's exactly where the pucker is. So let's see what happens over the next days. And then of course I have to buy smaller embraced on my next round. But what I'll do is I'll move them around with each. So you can see the scar all the way through. Let's see if it lasts 10 days. And that's how it's going to work, guys. So that's Embrace Scar Defense Therapy. We'll be using it for exactly 2 months. Each of these boxes have 3 in. So if you look at the results, they show you at the back. It looks like it might work. So we're going to have a look and see how that works out. So here we go. Active Scar Defense. And we shall give you a further review from here. Look out for my video for the review as well. And coming up this week, we're going to be doing our first exercise after our scar is healed and everything, and we have clearance to exercise. Thanks, guys. See you, chat soon.